Let's take a look at Chapter 2. These are developmental and cultural considerations in child counseling. So I think that this chapter provides a very systematic and thorough overview of what is meant by developmental and cultural considerations. And I think that when you proceed to studying counseling in graduate school, or maybe even here at the undergraduate level in Introduction to Counseling class, you'll have textbooks that focus primarily on many of the issues that are being covered in this chapter, developmental and cultural considerations. This chapter is, as I said, it's very thorough. It's very systematic. I don't find it bringing life to the topics at all. So I'm going to attempt to breathe a little life into this. But you'll have to read the text to really have a thorough background and to at least know that these issues exist. So firstly, talking about developmental and cultural considerations. I'm thinking when I see developmental and cultural, what we're seeing here developmentally, they're talking about cognitive development, physical development, social development, moral development, and development of personality, development of a sense of self. When we're talking about cultural issues, we're talking about ethnicity, ethnic identification, gender, sexuality, all of these variables that exist in the environment, in the cultural aspect. Inevitably, there are going to be strong opinions and strong attitudes, different worldviews about these things. And I'm going to tell you up front that it's not an easy task for anyone to not impose their own ideology onto the other. So what is ideology? Ideology is a term that comes from Marxism and Marxist theory, and it's a term that today we see more and more in the mainstream. And I treat the word as Marx did. Ideology is like dogmatism. So if we think of an idea or a worldview, in German the term is Weltanschauung, it's Weltanschauung. This is a worldview. It's a way of looking at the world. And if you consider that a way of looking at the world or a certain belief is a dogma, so different dogma, so there's a scientific dogma, there is a dogma of the humanities, there's artists have different dogma. When one begins to view their dogma, their belief as the one correct way, that becomes dogmatism. So we don't avoid dogma, we avoid dogmatism. We don't. We try to keep our own worldview and be aware of our own worldview, but not allow it to become our ideology. In other words, our way or our belief, and imposing that on another person. And I think that the best we can do when we're considering the counseling relationship. The best we can do is be aware of cultural, so environmental, and biological differences, and be very aware of our own dogma, our own beliefs, our own Weltanschauung, our own worldview, and keep that in check constantly, being aware of whether or not we're imposing that on the patient. And at the same time, becoming aware of that patient's worldview and helping them to have a better grasp and understanding, and maybe even develop a greater sense of awareness or understanding of their own worldview. in a way that you can not impose yourself in your system of knowledge on them, your worldview on them, but maybe use it as a way of being aware of it and using it as a way to ask questions that maybe you see the patient should be asking themselves. We have to really consider running the danger when we get into, as you'll see, some of the topics here on culture, ethnicity, gender, etc. Some of the issues that your patients will bring to you are direct results of their worldview, their worldview or their biology, so their culture or their biology, and it is not pleasant. It could be very unpleasant, but the individual needs to examine those beliefs and those understandings and see if they don't have some aspect to play in whatever difficulties they're having. After all, if a patient's coming to you, they're having difficulties. You're not going to them; they're coming to you. So be careful about accommodating too much with just a given that culture or biology is free from examination. I think these things, beliefs and biological limitations or factors, we could say, are necessarily must be examined and questioned. So we don't shy away from these differences. We remain aware of them, and I think it's part of our moral and ethical responsibility to ask difficult questions about not only our beliefs and our potential dogmas and ideologies, our Weltanschauung, but to have our patients really question their own. So that being said, I think that the fundamental issue when we're looking at developmental and cultural considerations, you can see here what the book is proposing to you. You'll know after reading their systematic approach. What we really can come down to, I believe, is an issue that we must address, a fundamental issue. And I believe that fundamental issue is in fact determinism versus free will. Now, if I go back to the developmental and cultural, if we regard these different aspects, biological, developmental, particularly the biological development, we're talking about, as we'll see, we're talking about the nervous system, the endocrine system, so brain development, etc., and how that affects an individual's personality and choices in life, what drives, etc. So if we think of the biological, traditionally this is called nature, and the cultural is typically called nurture. So one's culture is learned, one's nature is naturally, biologically determined, developed. We know, of course, this has now become a cliche. We understand that culture and biology, nature and nurture, are very much interdependent. We don't typically have too many things in the human condition that are clearly biological or cultural. It's usually a very complicated and mystical, uncertain interplay between culture and development. That is why no two children are living in the same house. No two children have the same parents. Siblings, brothers, sisters, brother and sister have each their own set of parents, and this is because we each interpret the other in a dynamic interplay. This idea of an objective, the parent is the same to both childs, or we see these twin studies that often give us the impression that genetically identical individuals, which in itself is a fallacy, there are no genetically identical individuals, are somehow growing up in the same environment. This just is not the case. There are no two same environments. It's a dynamic interplay between individual and environment. It's a dynamic interplay between biology and culture, between biology, nature, and nurture. So we look at this in a more sensitive way, and quite frankly, a way in which is very obscure and very ambiguous. We'll see different studies that attribute, try to break down an understanding, well, some biological or some psychological trait or some disorder is, 50% nature, 50% nurture, 60 nature, 40 nurture, etc. And this is really just playing the same game from years ago. It doesn't really tell us much. We have very, very few things in the psychology and in the human condition that have a clear-cut cultural or developmental causation. I can give you something that has a 100% biological determination, and that's eye color. That certainly is very simplistic. When we get into issues of the human condition, all bets are out the window, and I find little value in this approach of research to understanding things. I find that the more certainty involved with this type of research, the less interesting the findings, less important the findings. So when we think about nativism and cultural issues, so nature and nurture, when we look at environmental versus biological issues, both of these have the appearance. We often think, biology is very deterministic. This is the group of biological psychologists who popularized today under the term neuroscience, who often, at least in popular interpretations, like to claim that personality and behavior and intelligence and what have you, any aspect of the human condition is biologically determined. And we usually think of these individuals as the determinists. And then we have another set of psychologists who like to talk about how the child is treated when they grow up, what the socioeconomic situation is of the child, what the neighborhood's like, what education programs were offered to them, was there a piano in the house, were music lessons available, all these cultural considerations, environmental considerations. And we think, this is a very flexible, but in fact it's another form of determinism. If you believe that where you grow up and how much money you had growing up and things of this nature determined who you are today, then you are a environmental determinist. And if you believe that it has to do with biology and innate structures of personality and neurotransmitters that have very little to do with what school lunch programs are provided, kids are still going to choose nacho chips over apples, then you are a biological determinist. Both of these are forms of determinism. This is not free will. This is not choice. And we see much of academic psychology today dominated by this ideology of determinism. And I think it's the core central aspect that you have to come to terms with in your role and study as a psychologist and how you're going to view yourself as a psychologist. When it comes to counseling, I have yet to encounter any way that someone has convinced me that there's any room for any determinism in counseling. What I mean by this is, if you are a hard determinist, if you don't believe in free will, if you don't believe in an individual's ability to make decisions, or at least cultivate the ability to have more freedom in their willing, then I'm not sure you should be a counselor, because that's what counseling is all about. If you have the sense that biology is the determinant of the human condition, then you probably want to study medicine, where you'll do pharmaceutical and surgical interventions for these problems. If you believe that that culture is the big aspect, the environment's the big aspect of determining personality, you might want to go into social work, or you might want to go into community activism or something like this, or community health. Um, I don't see any way around uh, the counselor necessarily having to have a belief in free will, in the idea that we can make decisions. Now, this is a very complicated topic, and I think that, as you'll see as we go on with studying the different theoretical positions for counseling, that we have an ambition as a counselor to increase the idea of free will. So we take into consideration potential deterministic factors. We take into consideration, as this chapter is pointing out, what biological developmental considerations could be in place, what the child was born with, in other words, biologically. We also can consider the factors that the child is growing up in, the family's political sensibilities, their spiritual sensibilities, their socioeconomic income and education levels, and what neighborhood they live in, and all those cultural factors. We take those into consideration, but ultimately the emphasis is on expanding one's sense of volition. What is volition? Volition is the idea that despite the biological considerations, despite the cultural implications, the environmental implications, the child, the individual, if you're doing adult counseling, the individual is coming to counseling to expand their sense of volition, expand their sense of authorship in their bioenvironmental setting. So the reason that this idea of free will is so unpopular in academic psychology is because, of course, academic psychology predominantly enjoys viewing itself as a science. And science dismisses the concept of free will. In science, there must be determinism. We must have either some form of causal determinism, because that's what science is all about. If you recall from scientific research class, you start with a hypothesis, an idea, and you go then to a theory. And then what we don't have in psychology, but we do have in others, in real sciences, is in hard sciences, I should say, is going from a theory to a law. A law is something that it doesn't matter what the conditions are, it always occurs. We don't have any laws in psychology. There are a few things that are called laws, but they're not truly laws in the sense of physics and mathematics and chemistry. In biological psychology, we have certain lawful causal relationships of how things work at a cellular or a subatomic particle level, subatomic levels. However, this doesn't occur on the personal, phenomenological, experiential level or in the social level. No two individuals are in the same environment, of course. So you really have to come to terms and wrestle with the free will versus determinism question. As counselors, we are going to study the theories here with the assumption of free will. And I'm going to provide some things for you to read. William James, I think, was very useful in my studies of determinism and free will. Of course, William James wrote quite a bit on the idea of free will, and he treats it, as Plato did, as the useful fiction. So, in other words, a useful fiction is if it works and has real implications for life, then it's useful. This is James's pragmatism. So William James said, Although the scientific determinism can come up with many ways of disproving that free will actually exists, my first act of free will be the choice to believe in free will. So I'm going to include some of James's essays, and I'm also going to point you in the direction of Erich Fromm, Fromm. He was a social psychoanalyst, German American, and one of a great influence on my thinking. And Fromm wrote a few books on the idea of determinism and free will. Most famous is his book Escape from Freedom, which he actually describes how we do things to limit our freedom because freedom is so frightening to us. This is the idea that as soon as we get out of college and we're free to go and explore the world, we find ourselves getting engaged and getting married and limiting our freedom. In many ways, we get to a position of freedom, and it scares us so, and it's so frightening that we then do things such as take out a big loan for a car or a mortgage or education, which actually limits our freedom. Fromm also wrote a book called The Heart of Man, and this is one of the most amazing books on volition, free will, choice, and the human condition. And in this book, Fromm really takes from William James' idea that some people, and certainly when we're talking about children, children live very much in a constricted sense of freedom. Many adults as well have a very limited sense of freedom. They've intellectually, so ideologically, in their mind, in their worldview, Weltanschauung, they view the world in such a way that limits their possibilities. And in their consciousness, their conscious awareness of factors in their lives are limited to a way in which freedom is constricted. And we're really trying here with children, with adults in counseling, to expand their sense of freedom, their sense of volition and autonomy. These are very important words that are synonymous with will, freedom, the freedom to choose. And we want to expand the sense of freedom. And part of coming to do this in therapy is expanding consciousness. Consciousness is awareness. So when we're talking about being aware, we might start with the child who has a very narrow sense of awareness, and that child, if they're not challenged in this way to read, to watch a variety of different films and different music genres and not experience the same thing over and over again, and quite frankly, this doesn't mean the same song, even if we're listening to the same, if we're always listening to one type of music, we're pretty much listening to the same song over and over again, the same message. We want to diversify our listening to music, our viewing, our reading material. And this is a way of expanding consciousness. Now, when you expand consciousness, and speaking as a counselor, when you expand consciousness into realizing your own biases and worldview of developmental and cultural considerations, and you then become aware of differences with others, this is an expanding of consciousness. James tells us not to judge, but to observe. We can, instead of, and this James took from Buddhist psychology, from Eastern philosophy, one can observe and make observations about qualities that one may choose to adopt or dismiss in their lives. And observing is an act of choosing which are most practical, which are most effective in one's life. And that's different from judging. Judging is saying this is good, this is bad, and then dogmatism or ideology is imposing that on your client or imposing that on other people in the world. So this is as you see, we're in the realm here of very sensitive things that I think are fundamental to the counseling process. So I think at this point, if you've read the chapter, you're probably already realizing that this discussion, my lecture, is has more meat than the bones that are provided for by the chapter. Read the bones, the structure, the facts, and I'm trying to make this a living, breathing situation. We look at when we look at an overall kind of comprehensive view of the individual in development. We often look at the world of the child. This is Abraham Maslow's hierarchy of needs, the hierarchy of Abraham Maslow. And if you notice at the bottom of the pyramid, we have physiological needs. So Maslow, in his incredible writings, and I'll tell you, this is just really, literally a chapter, and his writings are so important and so much in the spirit of what I'm talking about in the past few minutes. Maslow was a humanistic psychologist. He dismissed the idea of psychology being a science, and instead a natural science, and instead said it's a human science, a humanities-based endeavor that was beyond the causation of determinism. And much of Maslow's writings and theories and books are about this expansion from a state of limited volition to a state of optimal volition, autonomy, choice. And that's what he called self-actualization. So he said that at the basis we have to attend to physiological needs: food, shelter, water, warmth, staying safe. And then we have the safety needs, the personal and psychological safety, a consistent family. In other words, one where the child doesn't wake up and wonder, is today going to be a day I get abused, or is it a day I get loved? There has to be a consistency that's present in the family and the safety or in the individual's life, not wondering, where am I going to sleep tonight, and am I going to be safe tonight? Next, after these physiological needs and safety needs are achieved, one begins to focus on higher level needs such as love and belonging, feeling accepted. And some people do this through finding a partner, finding romantic partner, finding a companion, finding a friend. Others do this today through joining clubs and fraternities and sororities and things of this nature, being a member of a special group or a religious group that are the chosen, or something like this. Or how many friends do you have on Facebook? How many do you have? How many likes do you get? Once you get to this, how many likes do you get? This it seems to be about the self-esteem, feeling good about oneself. And finally, Maslow says that we enter a state of self-actualization. And self-actualization, when you read Maslow in his own words, which I strongly suggest you do, you find that self-actualization is modeled upon the Buddhist idea of enlightenment. And what is enlightenment? It's awareness. Enlightenment is awareness, complete awareness, an ability to act rather than react, ability to transcend the ego. This is very much what we'll find in Jungian psychology. In Jungian psychology, we go from a place of ego, the sense of me, to an expansion of the self. The self is not the ego. The self, it goes and extends beyond the ego. The ego is just narrow little view of how important am I? How many friends do I have? Many of these love and belonging and certainly self-esteem needs have to do with ego ideas. self-actualization as a transcendence of the ego. So this is just a brief overview of Maslow and his hierarchy of needs, and I'm hoping that I'm whetting your appetite to take a look a little more closely at Maslow and what he has to offer. When we look at child development, we're looking at physical development, cognitive development, social development. I would add to this moral development. When we look at biological development, we're looking at the physical development. We're looking, when it comes to psychology, looking at brain development. So structures of the brain, processes of the brain, and considering what the implications for counseling are. What are the implications for counseling? Well, understanding that you're going to have to rule out if there's some sort of physiological consideration for whatever it is that the child is manifesting. So if the child has certain behavioral or emotional or social difficulties, you might want to find out if there has been if the child fell at some point, fell down the steps, or was in an accident. Was there some kind of brain damage? Was there some kind of difficulty in early development or in utero of situations that caused problems in the brain or in the physical aspects of the human condition? And you have to know to look into those things and keep them in the back of your mind. Otherwise, what could happen is everything will become psychologized. And when something is always looked at as a product of psychology, we sometimes miss that there could have been some kind of physiological implications. So we want to find out. How do you do this? Well, this is just being aware that the child has to, if you see that there's a history or some possibility, looking for signs that there could be a biological problem of development occurring, or maybe an accident that caused some sort of damage to the biology, then you have to refer that child to a physician, someone who specializes in those things. You're a counselor. You have then will have to, you're not a physician, so you have to refer that child so that you have the information that you know if your type of counseling is appropriate for that child. If the child has a brain developmental issue or a genetic developmental issue, that child then has to go to a counseling that is appropriate for their biological limitations. For example, when we have cognitive disabilities, what used to be called mental retardation, we have an individual who might not have the intellectual capacity to do insight therapy. If you have this type of biological or genetic or developmental issue of a low IQ, then you're probably not going to do depth psychology with this individual. You're going to probably have to do behavioral therapy, reward and punishment type things that have nothing to do with intellectual insight. It's just behavior modification. And that might not be what you've specialized in. That might not be the type of psychology or counseling you do. You then refer them to someone else. So like I'm saying, a lot of this chapter, the information that's being addressed here is the idea that you want to be aware of the implications and make sure that the individual, the parents, and the child are being appropriately treated with a therapeutic model that is appropriate for whatever it is they're dealing with. We see here some common genetic factors in the 5 child mental disorders: autism, ADHD, bipolar, depression, and schizophrenia. It's good to take a course in child development, not only lifespan development, but specifically a good course in child development, or read a good book in this. Textbooks are available online on Amazon. Get the textbook and read it. And we look at the signs of Piaget and others, Lev Vygotsky's stages of cognitive development. So where a child should be at any given time intellectually. And as review, we know that Piaget's stages of cognitive development, we have the sensory motor stage in which the child learns through the senses, and that's from birth until 2 years of age. So you know that this is a time when the children love to touch things, love to put things in their mouth, love to everything. They're sensorially engaging with this with the environment, and this is really understanding at 0 to 2 what's appropriate for a child. So like they learn through their senses by touching, by hitting, by biting, by tasting, smelling, observing, and listening. They're highly engaged sensorially, according to Piaget, and this is what he observed in Swiss children. In the sense, he called it the sensory motor stage. It's motor interaction and sensory interaction. They distinguish between me and not me worlds. So this, of course, comes into play with the mirror stage, the mirror phase that Jacques Lacan discussed quite a bit. The moment when a child looks in a mirror about 1.5 years and not only looks in the reflection but recognizes themselves in the mirror. This is the subject-object split. This is the moment when a child realizes that it is an independent, autonomous individual in the world, engaging in the world. And this has closely to do with language development as well. A little child learns language. They learn at this age is when they're starting to recognize themselves as separate from others. They love the two words no and mine. No and mine are acts, they're like swords. They're saying no, meaning I have my, it's the ultimate act of volition. As a matter of fact, you'll find your patients often fall into one of two categories as adults. People who need to work on saying no to others, and then another group who have no problem saying no and need to work on saying yes to others. So in childhood, the favorite that was when as soon as the me is understood in the mirror, the no and the mine, in order to have a concept of this belongs to me, my toy, one has to have a concept of me. So mine and no are acts of autonomy. They learn about invariance in their environment, so that chairs are for sitting, and that desks are for writing on, and etc. So they form the language, developing habits. They begin to communicate symbolically. They can distinguish between the self and other objects, including the mother, which up until this point, the mother is a complicated figure, we'll see, that's often not experienced separately. The child does not experience separately from themselves. Have the ability to think about things and engage in purposeful behavior, achieve a sense of object permanence. That means the understanding that things that are out of sensory awareness continue to exist. In the sensory motor stage, something that's not in sight is literally not in mind, and it doesn't exist. Something has to be in sight to be in mind. As children grow older, they begin to achieve object permanence and go into the preoperational stage, where they are no longer surprised that a red ball exists, even when Piaget's black beret is covering it up, and he lifts the hat off of the red ball. They're no longer surprised. They know it still exists. And they achieve the object permanence and begin a trial and error problem solving. This is if you watch with children at play, they don't go through things logically. They go through things in a kind of trial and error way. Did it work or did it not work? In the pre-operational stage that Piaget described, he found that children between 2 to 7 are not able to conserve in problem solving. So in other words, if they have a cookie and they watch you break that cookie into 2 pieces, and then you say which is more, the whole cookie or the cookie in 2 pieces, they'll see the 2 pieces as being more, even though they see you break the cookie in front of them. They're not able to have this idea of conservation, that change in shape does not constitute a change in mass. They have a great expansion of language growth, and research shows this has been a very controversial area of psychology that flip-flops over the ages, but I think there's enough evidence to show that different languages produce different experiences of the world. In other words, the language we speak greatly influences how we experience reality, how our worldview comes to be. You can look into ideas of linguistic relativism in this way to see how language shapes experience. Can classify objects more than one way, so you can by this pre-operational stage, a child can know that it can classify, say, a red ball by color or by spherical shape or by weight or by size, large or small, etc. They have trouble from 2 to 7 in reversible thinking, so thinking backwards, things of this nature. They prefer to learn things in ascending rather than descending order. They also have some problems with causation. So in this age group, 2 to 7, they might equally say, instead of saying Daddy has his umbrella because it's raining, they might think more poetically and magically and think that it's raining because Daddy has his umbrella. They're also egocentric thinkers. Typically between the age of 2 and 7, most children, Piaget found, feel that what they are seeing is what everyone else is seeing. This is the idea of egocentrism. Their experience of the world is the experience of the world. I can remember, I have a very incredible memory that goes back before autobiographical memory. And I can remember back to my first year of life, and I do this through flashbulb memories. I discovered this when I was studying psychology for the first time, and had images in my mind that I described to my parents, and they were images from as early as the first 6 months of my life. I could just describe in detail in the environment where my playpen was positioned, even as far as a window with a plant hanging in it and colors of walls and things of this nature. And I obviously didn't know the words for those things at that time or what I was looking at, but I had an image that was seared into my mind, and as an adult I can see that image and describe it. And things that I had when I started studying psychology, my parents were amazed that I would say I'm seeing this certain environment, and my mom said, well, this is where your playpen was situated in your first 6 months of life, and this is what you're describing. I didn't know where it was that I was describing, but I described precisely for her the office she worked in, that she would bring me to work in a playpen in the hospital, and I described this office to her. Well, nevertheless, we tend to develop autobiographical memory by the age of 3 or 4, along with language, that we begin to view ourselves as separate things in the world that we're having memories about. So in egocentric thinking, as I said, This is an idea that that a person feels that what they're experiencing in life is what everyone's experiencing. They're able to use mental images, imagination, and symbolic thought, and are capable of understanding simple rules regarded as sacred and unchangeable. Um, so children have very rigid ways of viewing the world. By the time of 7 to 11, they can conserve. They know that a cookie broken half is the same amount as the whole cookie. They can do reversible thinking. They can think backwards and work through a problem from solution to backwards. They have difficulty with abstract reasoning, but as we'll see, if with the right teaching, they can think abstractly. Ironically, younger children seem to naturally think abstractly. They see the world in animistic ways. The sky is crying, it's raining. A child might describe happy skies or sad clouds. This is very abstract thinking, but yet when we get to 7 to 11, concrete thinking is the abstraction. It's complicated. It's not exactly abstraction, I believe, that's the difficulty, but it's abstraction applied to a concrete world. It's juggling the abstract and the concrete together that seems to be the difficulty that Piaget observed. Because clearly, 2 to 7 children see very abstract ideas like talking trains and happy clouds and seeing the world in a very animistic and emotionally based way, very fantasy driven way. From 7 to 11, children become less egocentric. I always say that one of the best things you can do for young children, certainly by age 7 and up through 11 and 11 plus, is have them actively involved in some sort of service, some sort of social service. So I mean going out and on a clean up the beach or clean up garbage from the road, or helping in a hospital setting, visiting people sick people or elderly people in a aging community, things like this. This really seems to be an important factor in developing empathy and overcoming egocentrism and developing sensitivity towards others. It's one of the primary things that I always recommend to parents is get young children involved in service. They can, by 7 to 11, they start to be able to distinguish reality from fantasy, which I have trouble with, as I described earlier, because I think it's seeing the world shifting from fantasy to what we might call reality or socially accepted reality. Have greater capacity for concentration, attention, and memory. Not all children know how to concentrate. We have a lot of research that suggests that parents who know how to concentrate teach their children how to concentrate. Parents who became psychologists and doctors, medical doctors, and scientists, etc., know how to concentrate. They know how to think, and typically they teach their children, even if it's through example, naturally how to do this. Parents who are maybe not educated or have never learned themselves how to sustain focus, how to read deeply and with concentration, and to sit in quiet and contemplate, typically don't have children that know how to do this. It's a skill that's learned. So the capacity to learn attention, concentration, and memory has some definite factors of development and parenting, environmental, and other. Children just naturally have capacity for concentration, attention, and memory. So it's none of the statements that we discuss here are one size fits all. And they're capable of understanding that distance equals rates and time. So children of this age, 7 to 11, begin to understand that they can talk about how far away is the school. And that could be, well, it is 5 blocks away, or it can be it's about a 5-minute walk or a 6-minute walk, or it's only 2 minutes by car. So distance by time and space. By age 11, the child is now entering into puberty, and we have formal operational stage according to Piaget, and they have no need to manipulate objects to solve problems. They can sit and solve a problem in their mind without having the physical objects present. They're capable of abstract thought and scientific logical thinking, mathematical representation. They're begin to be able to apply ethical and moral principles. So, for example, they're able to say, why is it wrong to steal the pencil? Well, at age 7 or at 6, the child might say, because mommy said stealing is bad, or because stealing is bad. But by age 11 and 12 and teenage years, they've incorporated their own ethics and morality and they'll say, well, the idea of taking something that doesn't belong to me is wrong. It's not because there's a rule or because mommy or daddy said so. It's because there's a certain internalization of morality, a personal morality. That's a mature morality. Incidentally, we find adults who do not have mature morality. They live by ethics and morality because it's what the law says or what their religion says or something like this. And it's not an incorporated sense of right or wrong based on what one believes. And sometimes things can be legally acceptable and morally and ethically unacceptable to an individual. And that's mature morality. Now, when we look at Piaget, I'm going to look here. I want to mention, before we move on, that Lev Vygotsky is someone that really needs to be discussed. And Vygotsky was a social learning theorist. And basically what Vygotsky pointed out was that individual children can transcend the Piagetian the stages that Piaget described by one-on-one scaffolding. That is, if the teacher with the child works on a task in one of these stages, the sensory, motor, pre-operational, concrete, or formal operational stage, Vygotsky found that you can actually get children in the pre-operational stage to function at the concrete or the formal operational stage with the right teaching, one-on-one teaching. So these Piagetian stages are good things to consider, to keep in mind for cognitive development. But remember, as Vygotsky has described, Lev Vygotsky, that in scaffolding, as a teacher or as a therapist, you can have a child that in the pre-operational stage certainly learn the tasks and think at a concrete or a formal operational stage. And that is why Vygotsky is important. If we look now, this is just a brief overview of cognitive development. You want to keep this in mind when you're dealing with a child. These cognitive stages of Piaget, so you know where more or less you're starting at with potentially with a child, and then maybe seek out how to make considerations on how to approach teaching that child in a different way. Erik Erikson is a psychoanalyst. He was an analysand. He was trained by Sigmund Freud's daughter, Anna Freud. And Erikson is one of the most profound theorists. His book, Childhood and Society, is one of the most amazing reads you can do as a counselor, as a psychologist, wanting to understand children. And Erikson looks at child rearing practices in that book through different cultures, and primarily Native American cultures. Well, buried in that book, I think it's chapter 7, or the 8 stages of development. It's a short little chapter, and this is what most undergraduate psychology students know about Erikson. As with Piaget, as with Vygotsky and Maslow, I'm going to say to you with Erikson, go to the primary source material. Take an afternoon, go over to the library, sit down, and really read Erikson in his own words. Go online and look up his books on archive.org or any of his writings, and really get to know these people from their own mouths. One of the problems with textbooks is that you get secondhand information. You're not getting Erikson, you're getting the textbook author, in this chapter, in this instance, Henderson and Thompson's interpretation of Erikson. And now you're getting Giobbi's interpretation of Erikson. Fortunately, I've read Erikson in his own words, so I'm going to try to remain true to those principles. So in stage 1, Erikson described that from birth to about 1.5, that's that birth to the sense of me, or recognizing the self in the mirror. If you remember in the mirror phrase of Lacan, basic trust versus mistrust. The child comes to understand the place is basically a world that's predictable and safe for them, or it's a place that they have to be careful and is filled with danger. This primarily comes from the relationship at home with the caregiver, the mother and father, and the primary caregivers. Are they consistent? Are they attentive to needs? Something as basic as a mother or a father, but typically the mother, being able to identify the 3 basic cries of their baby. Not the 3 basic cries of babies, but the 3 basic cries of their baby. A baby, an infant, as Terry Brazelton points out in his book Touch Points, which I highly recommend to you all to read. Any of Brazelton's psychoanalytics pediatric books are wonderful, fun reads. And he describes the research behind a mother that is attentive to their infant crying because it's hungry, versus the cry that signifies I need to be physically changed because I've gone to the bathroom in my clothing. They need physical attention, or I need to be loved and protected and feel safe, a hug, held. It's 3 different cries. The attentive mother is able to hear a cry and develop a sense of which of those 3 is needed by that child. Now, take this into consideration. 2 siblings may have 2 different crying styles for these 3 different basic in first-year needs. The attentive mother hears these and is able to distinguish these. At this level, the child is learning whether the world will meet them halfway. They cry out, the mother comes for help. Maybe there's a mother that for some reason is unaware of this or distracted on the television or on the telephone, the playing the games. Or maybe the mother or father didn't really want the child. Maybe they're more interested in their own narcissism, in their own ego needs. That child is not going to develop a sense of basic trust. They're going to see the world as an unsafe, mistrustful world. So the first stage, the first 1.5 years of life, the child develops a sense that the world is basically a safe place or an unsafe place. And that, Erikson said, remains stable for the rest of that individual's life. In adulthood, the individual who sees the world as a place that's basically unsafe and you have to look out for me, I got to look out for number 1, the adult says. No one else will look out for you. This is usually a sign that the child grew up in a neglectful, unpredictable childhood. And then therapy will be, firstly, to as an adult, to expand one's consciousness, to becoming aware that not everyone views the world as a mistrustful place, and that in certain extremes, thinking it's too safe or too dangerous is not probably the most beneficial way of viewing the world. And this is an expansion of consciousness, and then consciously becoming aware of one's bias towards viewing the world as a dangerous place as an adult, and then how maybe that's interfering with their ability to have relationships and work well with others and have friendships, etc. Erickson described years 1.5 to 3 as autonomy versus shame and doubt. This is the time when we call these the terrible twos. I would prefer that you look at this not as terrible twos, but as a time of great exploration that the child is encountering. The parent who says, "Oh, the terrible twos," this is giving the individual a sense of shame for exploring. The child is seeing everything as interesting. It's the parent's obligation to make sure they don't hurt themselves. They don't put their finger in the light socket, an electrical socket, or they don't eat the shiny, they love sparkly things, so they don't eat the glass or get cut with it. So that's setting boundaries with the child and helping to protect them. But viewing them as terrible twos, viewing them as trying to get into trouble is just missing the point. And when one imposes that on the child, they're not directing them to safe behavior. They're discouraging them from autonomous and volitional exploration. And then, of course, the individual feels shame for and doubt in themselves rather than feeling a sense of autonomy, naming, self-named, volition, free will. Tied into this very intimately is initiative versus guilt. Again, read Erickson's short chapter in Childhood and Society, or look it up online and read this for yourself. You'll have a great explanation of initiative versus guilt. And this is between 3 and 6. A child will, very closely tied to the autonomy and shame and doubt, a child will begin to either feel competent that they can take and make initiative to choose their own way, or they'll feel a sense of guilt for choosing their own way. We often find in families where the parent is overbearing or maybe rigidly fixed to some sort of spiritual belief, religious belief, that the child who goes maybe following his own initiative that comes into conflict with a certain teaching of religious doctrine would then feel guilty for listening to that core of themselves calling. And whether or not that's positive or negative will reveal itself in adulthood when that child is an adult in therapy session coming to terms with those things. Ages 6 to 12, the child is getting a sense of either they have something to offer the social group and the world, or they feel inferior, they have nothing to offer. And this has to do with social interaction. And from 12 to 18, we have the adolescent stages of identity and role confusion, the big question, who am I? It's finding a sense of identity, closely tied to finding a sense of purpose in life. And this, in existential psychotherapy, is the core, and Jungian therapy is one of the core goals of psychotherapy, is helping an individual not only to find identity, but to find meaning and purpose in their identity as the core of their identity, and meaning and purpose that transcends ego needs. Look how powerful I am, or look how rich I am, or look how smart I am. That's all ego needs. And basing identity on not ego needs, but on a more expansive sense of contributing to others and contributing to society in a larger way that is based on self rather than based on ego-driven centrality. Yeah, so Erikson's stage is the stages are really useful, really important, and just a minor aspect of Erikson's writings. And so again, hang out in the library and take a gander at Erikson's, in his own words, really powerful, powerful stuff. And you'll study Erikson more in Theories of Personality class if you take that course. Here's a nice little guideline, something to just take a look at things regarding the developmental perspective. In normal achievements from 0 to 2, things you can just, milestones, eating, sleeping, and attachment. They're normal achievements in 0 to 2. Common behavior problems, stubbornness, temper, toileting difficulties. And clinical disorders, you can see signs of MR, mental retardation, feeding disorders, autistic spectrum disorders, so non-verbal activity, things of this nature. We'll be looking a little bit at these clinical disorders so that you have an awareness of them. But of course, counseling we're looking more at theoretical perspectives of counseling. And so these will be more specialized training if you choose to treat, of course, mental retardation or autistic spectrum disorders, depending on the severity, is really a matter of like a behavioral specialist, and not would have little use for, like I said, depth psychology or insight-based psychology. By age 2 to 5, language, toilet training, self-care skills, self-control, peer relationships, these are all normal achievements. Arguing, demanding attention, disobedience, fears, overactivity, and resisting bedtime, they're common behavior problems. And you can start to see clinical speech and language disorders, problems stemming from child abuse and neglect, and anxiety disorders and phobias. These are things that being aware of what is normal and what is abnormal and what is really clinically abnormal is important to observe. 6 to 11, academic skills and rules, rule-governed games, simple responsibilities are all normal achievements. Arguing, inability to concentrate, and self-consciousness and showing off are common behavior problems. ADHD is usually a big disorder that's diagnosed in the United States and the UK at this time, not everywhere in the world. Learning disorders, school refusal behavior, conduct problems. I always say when a child is refusing to go to school, you might want to listen to them. Maybe the child needs some boundaries set, that's true, but maybe there's something else going on. It's often there could be bullying, or the child could feel unsafe, or maybe there's even abuse going on from an adult in the school system. So I am very cautious. I try to get to the bottom. If a child doesn't want to go to school, try to really make that child feel safe in describing for me what their fear is. They might not even fully identify their fear, but children are smart. And it might be simply, or not so simply, but a matter of them overemphasizing their volition, being stubborn, when the child might need to learn boundaries with adults who know better. But that can't be the reflex reaction. The child, you have to listen to the child and get more information to find out what's going on. They could be trying to avoid an abusive situation. And finally, in adolescence, relationships with the opposite sex, personal identity, separation from family, increased responsibilities. Teenagers, this is what they're going through, this very mercurial, ambiguous transition in becoming an adult. Some of the problems is arguing and bragging. Like they overcompensate for their fears by having a grandiose sense of self. And some of the big clinical disorders, eating disorders, suicide attempts, drug and alcohol abuse. And we also see by this age, around 24, is around the time when we start to see schizophrenia manifest and depression. So these are highlights from the textbook, Principles for Understanding Children's Mental Health. Acknowledge the interactions within the child, their biological, psychological, and genetic factors. Just be aware of these. This is an overview of the things we're describing here. Let's take a look now at culture. And your book offers one definition of culture, the concept of culture as the support system for human beings, a way of life transmitted from one generation to another. We see many different challenges, cultural challenges. I would say that in the beginning, what we need to do is really examine our own culture. We have to understand, before we understand another's culture, we have to know what our cultural biases are, what our Weltanschauung, our worldview. Have a strong sense of your own ideas of stereotypes and assumptions about others, your own social class, knowing your own peculiar take on reality based on your own psychology. This is why, of course, most therapists, most therapeutic programs require in psychoanalysis at least, require the individual to undergo analysis before helping or giving analysis to another. You have to know that your own house is in order before you can help someone straighten up their house, is one of those sayings. So being aware of being aware of one's own worldview is primarily essential. Then look at trying to understand the worldview of the client. And how do you do this? Well, you do this by you do this by talking with that client, by listening to them, asking questions, helping. You're asking them questions so that you can understand their Weltanschauung, their worldview, their experience. And in so doing, they're articulating things that they may have never thought. You're asking them questions that they begin to ask themselves, and this is an important aspect. Here's some cautions that I think are useful to look at. Diagnoses differ across cultures. There are diagnoses, when we're talking about clinical diagnoses, so counseling, you can have diagnostic counseling or non-diagnostic, depending on how you're choosing to work. If you're working from within a DSM model, say for a school or insurance reimbursement or something like this, then you're going to have to diagnose. You could be a counselor who chooses not to diagnose and doesn't participate in insurance company requirements for diagnosis, etc. That will be up to you. So the idea here is that the DSM diagnostic criteria There are diagnoses that exist now that didn't exist 100 years ago, and diagnoses that existed 100 years ago that don't exist now. We didn't find cures. It's just that these are not cancer diagnostics. These are not biological diagnoses in many ways. These are social, cultural, personal, psychological phenomena that manifest and are not consistent from period of time to period of time, and they're certainly not consistent from culture to culture. There are diagnoses that exist in Western culture that don't exist in Eastern culture, and Eastern diagnoses that don't exist in Western culture, etc. So always watch how certain you are of what you've learned from your cultural perspective as a scientist of psychology, a diagnostician. Cultural beliefs influence diagnosis and treatment. Clients express symptoms differently across cultures. A sign of self-confidence could be silence. It's not always self-confidence as being, boastful or this is a good example of that. Diagnosis may vary according to categories found most often in the majority of populations. So when you're looking at those DSM, you're looking at gross rather than fine descriptions of individuals. And most counselors are members of the majority population, whereas most clients are members of the minority population. That is a rather complicated statement, and let me unpack that a little bit. I think that if you're working in a school setting, if you're going to be a school psychologist, or you're working in maybe even community mental health in a clinic, then the people that you are going to see, the clients that you're going to see, are going to be quite diverse, probably very different perhaps from you, because they are not choosing you, you are appointed to them. If you're the school psychologist, then you're appointed to all children in that school. Now, this is why I'm a little cautious with this. If you are a private practice counselor and you make yourself available in the community, you choose a community to work in, I would imagine that the community where you're setting up shop in, the community where you're opening your office up, or where you're getting office space to work out of, is probably a community that's comprised of patients, clients who are going to seek out your care. They are choosing you. So they're probably going to look at your description of, if they go on Psychology Today or whatnot, they're going to look at your description of what you have to offer and who you treat. They're going to look at your appearance. They're going to look at the maybe pictures of where your office is and what the interior looks like. If you have a website, you show these things. And these patients, or the parents of the patients, are going to choose you. Typically, people are going to come to you based on their perception of you and their comfort level with you. Unless you're working in a setting in which your clients or patients or children are coming to you out of a school system and you're seeing then it's going to be less of an issue to be aware of these differences, these what they call majority and minority, or maybe marginalized and centralized individuals. So you have to be aware of it. You have to take this in consideration based on the individual that you're seeing at that given moment in that population. And these, of course, are very sensitive issues to consider. So this is a basic introduction to this idea of cultural and developmental considerations that we have to make before we even begin looking at the counseling process. We have to, I would say, in my offering to you, is to treat every individual as an individual, get to know that individual's worldview, get to know that individual, since we're dealing with children, the parents' worldview, understand the difference between the conflicts and similarities between the parent and the child's worldview. Probably beyond this, most importantly, get to know your own worldview. Become aware of your own assumptions and do your best to experience the world outside of your cultural assumptions. My advice in concluding this discussion of this chapter, it would be to, as William James offered, and as the Buddhist psychologies offered, focus less on judgment and more on observation. What works for an individual in their circumstances might not be what works for you or another individual in their circumstances. And the goal here is to help the individual to make the best autonomous, volitional, free will choice for themselves to expand their own sense of volition and to be able to make a decision that best fits them, and the ability to abandon that decision if a better one shows up, if a better one occurs. And this is observing and practical use rather than judgment of good, bad, right, wrong.